today's topic is healthy habits for healthy kids. Before I start, I want to read this verse for you. Jesus is a perfect example for everything. So even from his childhood. So uh, if you can open the Bibles, you can read from Luke chapter 2, verse 52. So, and Jesus grew in wisdom and stature and in favor with God and man. So I want to tell you how to grow in God's way. So as our Lord Jesus has grown in all the four parts, by wisdom, in stature, in favor, and in honor. So he has grown in all the four components of what we are going to see today. As I have told you, so wisdom, it is the intellectual being, intellectual health, or the health due to the mind. So he has grown in the wisdom, in the stature, that is we can tell that it's a physical health, and in favor with God, he has grown spiritually. So that is also very important, and in favor with man. So that is the social health that we can tell. So we are going to see healthy habits for healthy kids. So I have to tell you about what is health. So it is the WHO definition, that is the World Health Organization definition. What is meant by health? So it is the state of physical, mental, and social well-being, and not merely an absence of disease or infirmity. So it's not only without disease, but also the complete wellness. And what do you mean by wellness? So wellness, it is the state of living a healthy lifestyle. So we all want to live a healthy lifestyle. So this is what I'm going to tell today, how to live a healthy lifestyle. So it is the active process of making choices toward a healthy and a fulfilling life. So it is a holistic approach. It's not only, what we have seen from the health is it is physical, mental, and the social well-being. But added to that, if we add the environmental aspect, or where the surroundings, and also the spiritual and the emotional things, everything included, that constitute wellness. So as we have even from the topic, we can know like healthy habits. So I want to tell what I mean by habit. Your habit is something that you do often and regularly, sometimes without knowing that you are doing it. Okay, so this habit is formed when we do some things like every day, we even without our consciousness, we will be continuing without that. Okay, so it can be done unconsciously, and often it can be done compulsively. And once the habit is formed, it is very hard to give up. So this habit formation, it can be a positive habit formation, or it is a negative habit formation. So this, once the habits are formed, then it will become a character of our life. So it's very important that we children and the parents have to make the children develop the positive habits in their life, so that they will become positive and healthy human beings in days to come. So how the habit is formed? So you can see the habit loop. So habit loop means there will be a trigger to the habit. So for example, as soon as you get up, you go to your washroom, and as soon as you see your toothpaste and the brush, automatically, even if you are sleepy, even if you are not fully aware of the environmental surroundings, immediately your hand goes to the toothpaste and the brush, to brush your teeth. So how it's formed? So every day you are doing that, even if nobody has to tell you. Go every day. Okay, so this is what. So something like when you see there will be something which triggers the habit, and that is called a cue. And it can be a location, a time of the day, or some people, or some emotional state, or some action before that. And once you do it every day, that will become a routine in your life. Okay, so but this routine is very important. So you have to do it consistently. You have to do it every day. some saying is like, if you do consistently maybe for 45 days or so, that's what, like, so it will become a habit. For anything, like if you're doing consistently, that will become a habit. And this is the routine, that also, that is the element which, if you are having some bad habits at also, that is the area that we have to bring the change. And anything, the habit, it will become, it will be done every day only if there is a reward. So this is the benefit which is gained from doing the behavior. So our brain will decide the previous steps, and it will remember to do it again. So for example, these are the habits of cleanliness. So we all know, and our parents would have taught you even from your small age onwards. So starting from, so for a healthy human being or healthy child, so these are the cleanliness is very important. And starting from the oral hygiene, that is brushing the teeth, having a clean water bath, and carrying off the hair, carrying off the food, that's washing the feet whenever you go out, and whenever you go out to play, and if you're coming home, so you are caring about your food. And especially the toilet, how to use the toilet, how to wash after using the toilet, and how to wash your hands after using the toilets. And whenever you are having some cough, or you are having some sneezing, so the covering of mouth or with a hanky. So these are the things, like it has to be taught to the kids, because they are just like that, like, everything has to be taught. So these are the positive habits you need to, as parents, we have to tell our children to do, and we have to train our kids to do, so that they will be practicing that when the days to come, like. And also how to keep their surroundings clean, how to keep their books in the proper place, how to keep the environment that tidy and clean. Okay, so these are some habits. So coming to the main topic, that is the physical health. I told you there are three aspects of health. There is the physical health, the mental health, and the social or the emotional health. So coming to the physical health. Physical health means there is a healthy body. So there are three components. One is diet, the second one is exercise, and the third one is sleep. So as you see, you have to eat healthy, you have to get up plenty of sleep, and you have to do exercise or a play. So diet. You can see a picture of my plate. So all kids can see. So how you're going to fill your plate, that is like what the diet. So your diet should contain it should be a balanced diet. What do you mean by balanced diet? So anything, like whenever you eat, or especially the three major meals, so your diet should contain adequate amount of proteins, carbohydrates, and fats. So if you can see, the grains constitute the carbohydrates, and the protein, that is the fish, the meat, the milk, and eggs, that constitute the proteins. And fats, fat should be a small amount. It should not be very big amount, like around 5% only the fat. But it should contain a lot of vegetables and fruits. The fruits and vegetables should be colorful. That is called rainbow colored fruits and vegetables. So you have to include everything in the diet. And if you can see, previously there was a thought, like in 10 or 20 years back, the carbohydrates are the main portion. But now it has been changed, and we have to take more amount of vegetables and fruits than our whatever, like 1/4 alone should be the carbohydrates. And you should drink a lot of water, and you have to avoid sugary drinks. So grains, half of your grains should be made whole, and vegetables eat the different colors. Focus on the fruits, and for calcium, you drink milk every day, and for the meat and beans, you have to go for the lean proteins. So this is the nutrition pyramid. So this is the modified pyramid that contains the base of the pyramid. The base That's a large amount should be the fruit and the vegetables. Then we can go for the carbohydrates, that is around 20%, and the meat and the milk comes for another 15%, and healthy fat, healthy oils, that contains another 10%. And water, it is very, very important. And as children, like according to their age, so as for example, if you are around 10 kilogram, you have to drink at least 2 to 4 cups of water. So it should increase as the child grows in age, and minimum 8 cups per day for a 20 kilo child you have to drink. And always, not only the diet, like not only the food we eat, but also family environment, that is very important. You have to encourage, as parents we have to sit together and eat, and they have to follow the table manners, and you have to be an example when you are eating in front of the kids, so they will also learn whatever we are doing. And coming to the second part, that is the exercise. So exercise, we all know kids always want to play. So this is the physical activity. Exercise means physical activity. Whenever there is a physical activity, it builds the strength, it also builds the coordination, and also gives the children the confidence. And it is recommended that every child has to spend minimum 60 minutes up to 120 minutes, that is around 1 to 2 hours of active playtime every day. And there are so many benefits. Because I'm not having much time, I'm just telling, like, this will all make our muscles and bones very strong. And you will, now the children are always sitting in the home, and most of them have been on overweight. So these things will reduce, like if you keep playing, if you spend outdoors. Okay, but if it is not possible, at least you can do some kind of exercise at home, so you can be fit. And also it for the long term, it reduces the risk of type 2 diabetes, blood pressure, and the cholesterol levels. So exercise not only benefits the bones and the muscles, but also it gives much benefits to the brain. How it increases, how it causes the benefits to the brain, because it increases production of some certain neurochemicals. Because when you exercise, some neurochemicals are released in the blood, and this will promote the brain cell repair. And also it improves the memory, it increases the attention span, and when children are they have to make a decision, it will boost the decision making skills. And it also promotes the growth of new nerve cells and blood vessels. But also for multitasking and planning, it helps. And the third component I told is sleep. This is also very, very important, because this is the essential building block for not only the physical, but also the mental development. So as we have seen, the physical development, what are the things, but this is a bridge between the physical and the mental development. So our body and brain need sleep. But as the kids grow older, the requirement may decrease. I will tell you what is the sleep requirement in my next slide. And if, as parents, we have to allow our children to develop healthy sleep habits, because the sleep should be a sufficient one, and it should be family priority. You should not actually, if the child has not met the required time of sleep, you should not be very hurried to do their work, and they have to get the proper sleep to get recharged again. So it should be a regular or routine time every day, and the children should be active during the day, and they have to sleep in the night time. And also in the sleep, you have to monitor the screen time. I will come to that later. And keep a safe environment for the sleep. And if there are any sleep problems, sleep associated problems are there. So if you recognize something, you need to consult the healthcare professional early. So certain tips, like as I told, you should have an evening routine. That means you have to prepare the child to go to bed. It should not be like, just go to bed. So from the evening time onwards, after they finish the dinner, so it's better to maintain minimum 2 hours between your dinner and before sleeping. So no late dinner or snacks, and have an evening routine. You can just give a bath, or you can change their clothes because they would have played throughout the day, and you just set the time, set a routine for sleep, and turn off all the electronics. That's very important. That should be turned off minimum 1 hour before going to bed. And you can have a small play before bedtime. uh, Better to keep the room dark and cool, and read or listen to your stories. For Christians, this is always a prayer time or a Bible story or some verse, so that children, like, every day, this should be the routine, and this should uh, be done every day, so that the children will be able to know that they are going to sleep. Okay, so as I told you, these are the sleep guidelines, starting from the newborns, like, because the newborn babies, they require more hours of sleep, like around 14 to 17 hours. And when they reach 1 year, it is reduced to 14 hours, including the naps. And when they reach 2 years, it is around 12 to 14 hours. And up to three to 5 years, we can allow the child to sleep for 10 to 13 hours. And 6 to 13 years, it is 9 to 11 hours. And 14 to 17 years, it is 8 to 10 hours. And adult sleep, we all know, it is around 7 to 9 hours. So this is the recommended sleep. Sleeping more than this is not good. Sleeping less than this is also not good. And if the child is not having a good sleep during the childhood, it will lead to an increased risk of attention deficit hyperactivity disorder. So child has to sleep. The sleep time should be appropriate. It should be regular, because these are the other disorders which can come due to the poor sleep, and can perform, if the child is not sleeping properly, he can perform poor academically, and they can develop behavior disorders and more. And especially allowing the child to sleep with some screens, that is also not recommended. And coming to the next aspect of health, that is mental health. You may think, what? So we all know the physical health. So mental health, this is also very, very important. And this needs more attention, even I can tell it more attention than the physical health, because mental health starts very early and it persists a lifetime. So whatever it started, it will persist a lifetime, but not like physical health. You can just change. You can, if you're overweight, you can do exercise and reduce your weight. But this, this is very important, because this is related to the baby's development, his emotions, his healthy social skills, and also whenever there are problems, how he is coping. So all deals with his mental health. So when mental health means mind. So children, there are three basic functions of mind. So thoughts, whatever you are thinking, how you feel, the feelings and the desires. So this is the mind. It is the seat of all the imagination, the will, the memory, the intellect. That is the wisdom and the thoughts. So how you keep your mind, how you develop your mind to function in a very optimal and positive way, that denotes how good your mental health is. So you can see I have some positive habits of mind. As we have seen some positive habits for the physical health, this is also some mind habits that are positive. So children can develop, as every day you have to make some, as I've told, it's a wellness. You have to take an active process to develop these habits. First one is persisting. So even if you fail, don't lose heart. Failing is always there. So I will keep on trying. You have to tell, I will keep on trying. And how you are managing the impulsivity. So if you are just acting without any thinking, that is not good. So always think before you act. Whenever you do a thing, you always think before you act. And if somebody is sad, or if somebody wants to tell something, you have to listen carefully. You should not actually always over talk, or you should not just always tell your opinions. So you train your mind to always listen with understanding and show empathy. Empathy is like you are actually bringing their feelings to you. Okay. And think flexibly also. Do not always, okay, this happened, so I will always do like this. No, you have to try different ways every time. Think flexibly. So think before you act. That's what. And also think about your thinking, what you're thinking, what your thoughts are. So you have to think. You have to be aware of what you're thinking. That's that, because that is the very important thing. As we are Christians, we are hearing every day, like, how to be the child of God. And today also our pastor uncle has showed how to, like, the mind, the spirit controlled mind is full of power, if it's full of love and sound mind. So how, what you're thinking, what you're putting your the thoughts you're putting inside your brain, that's very important. Okay. And also strive for accuracy always. Whenever, why they are actually, for example, if you're this handwriting training, so always, you want to be sure my work should be perfect one. So you have to improve. You may not be able to attain that in the first time, but if you do on, so it will really help you. And whenever you face a problem, you question what is the problem and how I can do, how I can go for that, how I can face that. So you can actually think all these things. You can ask thoughtful questions to your mind, and you can prepare yourself. And also, if you have known like previous situations, like, you have you have learned something before, and if when you're going to come across the same thing again, you can apply the past knowledge to the new situations, and you can try. So everything, every day is a learning. So only by applying your knowledge, you will learn every day. And also, whenever you communicate, whenever you speak, you have to choose your words carefully. You should not just like the blurt out words, because all words, as it is said in the Bible, our words, we have to give account to God. We have to give account on the day of judgment. So whatever you speak carefully. And also, you pay attention to the world around, okay, and learn from it. Try to take risk. So because without risk, nobody can learn anything. So you have to take, and you have to take safe and responsible risk. And take time to laugh every day. Every day you, because, and children, like, make it a habit to laugh every day. Make it a habit to like you play and laugh every day. And also, as you are at home now, you are having vacation, so you can create and innovate new things. You have to use imagination, whatever you like, some crafts or some drawings or some paintings, like, so you can create everyday new things. So that will really help you, to be to develop a positive, strong mental health. And also, whenever you do something, like whenever you find something new, you be amazed and search, we respond with wonderment and awe. And also, you have to work well with others. You have to, your siblings, like your brothers and sisters will be there. You have to think independently, but also you have to work together. And always be open to learning. So every day you will learn new things. So you have to always tell, I love to learn this. I love to learn this. You should not, no, I don't want. You should not be anxious, to learn new things. And I have included the social health also with this, because the mental health and the social and the emotional health are linked together. Because if you are good, you are having a good mental health, you will automatically have a good social and emotional health. So social means ability, like, in the society, how you are interacting with the society. And emotional health is how you're managing your emotions and your reactions. If something happens, how you're reacting, and how you're maintaining the relationships or the friendships, or with your parents, with your siblings, with your friends, how you're managing the relationships. So first you have to think about, like, there should be a sense of self, and you have to develop certain social skills for communication, how to behave. So behavioral skills and the emotional skills. So whatever I have told, and how to control your emotions, or how to express your emotions. So emotional health is like expressing your emotions in a positive and non-destructive way. So you can see all the emojis, like, the if you're happy, like, because the children always, like, not wanna, like, we are not going to be in the same emotional state forever. So we will always experience different emotional changes. So how you are expressing those emotions, that also that's also called the emotional health. So children, you can see this is the feelings thermometer. So starting from the blue up to the red, you can see the various emotions which are being shown. So if you're happy, you are calm and content, you will be smiling, laughing, and you will be always like, always excited. And if you're sad, you can be sad, you can be sometimes negative, you can sometimes feel lonely. So that time, or like your emotions may be crying, you may be withdrawn, you don't want to speak to anyone, or you are, the excitement, everything will be slowed down and you want to get disengaged of the surroundings. And sometimes you may be anxious and worried or unsettled, like, something like is always disturbing your thoughts, or you want, like, something like, maybe fear, maybe some worries which is always coming and always so you may be anxious at that time, or you may be frustrated, like annoyed and irritable. So these when this emotion comes, you will argue, you will refuse, you will shut down, so you don't want to do anything, you will always fight with the parents, and you know so, and if it increases further, then the anger will explode, like it will yell, you will storm, like you will melt down, you will all show all the temper tantrums, like you are explosive. So these are the like common emotions every day a child can experience, and how you're dealing with the emotions, that is very important. Okay, so if you're happy and calm, it's very good, so you can enjoy the positive mood and enjoy the activity, and also you can help someone else. So if you're happy, you're always energetic to help someone else. And if you're sad, okay, so you have to you can see the right side, like, if you feel sad, why you are sad, you have to, like, you can take a diary and you can just write why you are feeling sad, what is the reason why I'm sad. So if you write, you will, you'll know, so how you can avoid that, or what can you do further to prevent the sadness going too deep into your mind. So you can do that like that, like you can journal your feelings, or you can tell to your parent or your friend what you're feeling, and also set a positive goal for the day. And if you're anxious over it, talk to your family member, and you know focus on what you can control, how you can control. I will come out about that later. This anxiety, I will I will talk about that later. And if you're annoyed or frustrated, and meditate or pray. So if you're irritable, just it's better to have a timeout, go alone, listen to your favorite music, or you can just, you can be alone for some time, or you can just read a verse, or uh, pray. And if you're angry, you have to calm down and take some deep breaths, go to take a shower or bath, so that your anger will come down. And also you can do some exercise. So these are the steps. So how to difficult emotions, especially this anger, the frustration, the anxiety, the worries. So first you have to accept that you are having these emotions. That's very important. If you don't accept, if you're just arguing, I don't have, then if you don't accept, then you're not going to deal with that. So you have to accept and identify and label the emotion. Say, like, so you have to identify if this is anger or this is anxiety. Identify and accept your emotions and acknowledge that emotions. And always think these emotions are not going to be permanent. It will go away, it will pass. So that is a fair, that's a very good thing. So you're not going to be sad always, you're not going to be angry always. So this will pass away. So how I will be able to cope up with that? And also you can inquire and investigate what has triggered me. Why I have done that? Why do I feel this way? Okay, so you can inquire and investigate, and also let go of the need to control your emotions. Sometimes, you may have to, hit something, like, okay, hit. Okay, after that, if you're settling off, it's fine. Okay, or you can do the coping skills, like read a book, listen to your music. You can take 5 deep breaths, or take a break, talk to an adult, or count slowly, or exercise. So these are the other skills you can cope the emotions. But if a child is not able to handle his emotions, or if he's, like if he's disturbed mentally or the socially, so we can have the troubled child. So if a troubled child, there are two things, initial things that you can notice in a troubled child. His school performance will be decreased. That will be like falling grades. He was performing before well, but now he has come down. He was initially he was always getting A plus. Now it is like B plus or B or C. So why they're like falling grades? And he's not able to concentrate. There is lack of concentration, and he wanted to skip the school also. He doesn't want to go to school. Or you may notice a change in his behavior. Before he was a talkative, but he's talking very less than normal. He's persistently sad or being alone. Then you have to this is very important. These are the early signs of a troubled child. And if the troubled child he's not found out, or he's not treated at the right time, there can it can lead to certain behavioral problems in the child. He can have extreme mood swings. He can have the sudden outbursts of anger with use of foul language. He develops a low self-esteem because of that. Whatever he's doing, he'll feel sad after that. Oh, and defiant. He's not obedient. He's always arguing, always fighting, always not adjusting with his siblings. And he can lie and steal also in order to overcome whatever he's experienced. He will lie. He will say lies, and he may steal, and his sleep patterns will be changed, and he may be withdrawing from the usual activities he was doing, and he may have the poor hygiene. And sometimes in order to just he will use the electronics, like whatever he's having the screen or the mobile, he will be using excessively. And also he can have some physical complaints. So these are the behavioral disorders. But today, there are so many behavioral problems which can lead to some behavioral disorders later. I don't want to go into all of them, but I want to just tell two of the behavioral disorders, this anxiety and the stress. So anxiety in one, all the children would have experienced some form of anxiety or the other, because anxiety, this is a reaction to the stress, whatever, we are facing. So that is normal. But if the anxiety, it is persistent without any trigger, without any, stressor, without any other problems, what if the anxiety is always presenting, and if it is presenting more than 2 weeks, so that is abnormal. And if it is presenting more than 2 weeks and up to 6 weeks, and if it is increasing day by day, then it is high time that you meet a healthcare professional, especially the child psychologist or the psychiatrist for that. So there's the children who are having the behavioral problems. They may be, if they are showing the difficulty in concentrating, they are feeling worried always, they are having the sleepless nights, and they are avoiding all the activities they were doing before. And along with that, they will be having the stomach upset. They will just, I have seen children just coming, without any other things, we will examine everything, but they will just complain of stomach pain. Even if they do scan and everything, blood tests and everything will be normal, but the child may be facing the anxiety, so it can present with the physical symptoms. Or the child is excessively crying, always crying, or he's very much he's having difficulty in managing the emotions. So what you can do, you have to, as parents, first, whenever a child is if you feel that you are having if you're dealing with a child who is having the anxiety, the parental support is the first thing which is needed. So support your child to face their fears. Talk to your child about the worries. Maybe they may be having some worries, so you have to talk. And you have to teach how to cope, the skills like relaxations or praying, or, so how you can actually come out of that. You have to help your child, and help your child to solve the problem, whatever he is in. Help him to solve the problem and be a role model. If you are anxious, the child will be always anxious. So you have to reduce your anxiety, and you have to be calm and patient with the child for his coping behavior. And you can create a worry time, just to deal with the worries. And listen, this is very, very important, because all parents, we are all busy, we are all going to our work, and we are not having time to listen to our child. So that's very we are lacking in that, and we need to we need to separate a time to listen to what the child says, and be calm and patient when helping your child. Don't be angry. Don't be, oh, why you have done that. Child may be anxious or maybe worried about something which he has done. You should not be you should not approach it negatively. Why you have done that and these things? Like maybe he would have stolen a thing, or maybe he would have like lied to one person, and now he's feeling sad for that, and he's thinking every day about that, and that has caused his anxiety. You should not be always, negatively approach. Be so you have to tell that it is okay, that wrong has been done, but now how you can help your child, and also make sure that they are eating healthy food, and also they're getting enough sleep. And if you are not able to manage, then always seek out the specialist help. But if it is not, if you are not able to handle, then that this anxiety can lead to stress. This is one of the most commonest mental disorder which we are seeing. And if it is not found out at this stage also, it's very difficult to control, because it can lead to other form of mental disorders. So this is very important. So if you're facing your child, if this is also a sudden onset, it's not from beginning that your child was well and good before, and now he's showing some emotional withdrawal. That means he's not, he's always crying, or he's always clingy, or sudden changes in the behavior. Before he was doing everything fine. Now for the past 2 weeks, he's not doing that. He's always like depressed, he's alone, and irritability, crying for no reason, for every time he's crying. Or he has developed some new habits in order to hide his stress. He has started chewing his hair, or he's started thumb sucking again. It is normal for children from the newborn to up to 2 years or so. Like they can like they'll do the thumb sucking. But if the child has started recently the thumb sucking or the fingernail biting, and he's not sleeping in the nights, and he's always rocking, like he's always rocking like that. And if you feel your child is depressed and seeing, like he's sitting alone, he's not speaking with others, or if he's always having a cold or sweaty hands, and the anxiety what I have told, and he's nervous, he's grinding his teeth, along with some physical symptoms like headaches and stomach aches, and he has recently started bedwettings and throwing the temper tantrums always without any reason, without any trigger. He's throwing temper tantrums, easily clingy. So if you are seeing these symptoms, if it is persistent, and if it has a recent onset, and if there are no other triggers which are making these symptoms in that child, then you have to understand the child is undergoing the childhood stress. The childhood stress also, like if it's persisting for more than 2 weeks, you have to get the specialist help. So why I have talked so much about the mental health? Because 1 in 5 children suffer from a mental health or a learning disorder. 1 in 5. This is very, very common. So we, as parents, we are the ones who identifies our children, whether my child is facing these issues. There are so many things like to be told about this, but because of the lack of time, I'm just finishing mental health with this. 1 in 5 children, they suffer, and 80% of the chronic mental health disorders, they begin in the childhood. So be careful. And anxiety disorders can make the students 2 times to drop out or fail a grade. And mental health problems in children from age 6 to 17, it continues to rise. So that's why this much importance to the mental health. And how you can nurture as a parent, how you can nurture a child's mental health. First of all, be with the child, be present. That's very, very important. Be present with the child. If you are not present with the child, if you are doing your work and you are going somewhere and you're if be present with the child, and set and respect boundaries. Like you need to create certain boundaries at home, and you also have to respect. You have to be a role model in respecting the boundaries. And always model forgiveness. If you forgive your child will also forgive somebody. So always, don't always ask don't always tell their whatever they have previously have done. Don't always try to make out bring the mistakes again and again. And respond calmly when their emotions are elevated. When they are having anger, you have to respond calmly, and view their behavior as a window to your needs and to their needs and feelings. So this is the window. Their emotions are the window. So you need to be aware of whatever I have told you before. So view their behavior as a in window, and make play and exercise a requirement. Every day play with the children. This is very, very important. How they are, you have to play with the children. Then only you will, you'll make their minds healthy and happy. And recognize the positive choices. Tell them how to recognize and practice the relaxation and the exercises together, like praying together, reading the word of God together, you can do. And believe in them. That is very important, because the children want their parents to trust them. So these kind of things, like, it will help a child to come out of that. And be consistent and follow through with what you promise. If you are told something, like, want to do it to child, you be consistent in that, and model a healthy behavior. So children, we are the models. The parents are the models. So they are always looking at us. And if we are living a different life, and we want to exert a other life to our children, they are not going to follow that. And always tell the truth. Always tell the truth. This is very, very important. Honesty and integrity comes, like, if you tell the truth, our children also will tell the truth. Even if they tell a lie, even if they have lied sometimes, but they always watch you. If you're at home, don't tell your child that to answer the phone, to tell that mama or papa is not available. No, don't do that, because they are always watching. You may think that is a trivial thing, but that brings lasting impressions on their mind. So they will think, okay, I can also do that. My papa is at home, but he's telling answer the phone that I'm not available, so I can also do like that. And share your feelings with your children and validate their feelings also. But also be patient. Always be patient whenever you face some mental issues, or some mental health problems, or some behavioral problems in a child. Be patient with them and actively listen to them before or offering your advice. That is very, very important. You have to listen to them before you offer your advice, and surround them with healthy adults. So here in Kuwait, we are missing that. Our grandparents, so like we are in a single family unit now. The compound families will help, especially, and teach them how to be safe. Some children may be anxious or worried about something, some safe issues, especially girl children, maybe some abuse. So they don't want to tell immediately, like outside. So teach the children to be safe, how to protect them. And also use this open-ended questions. Like, you have to ask, like, what happened to you? You just tell. So be a patient parent to listen what the child is having inside his mind. And also have a scheduled family time every day. Limit the electronic time. That time you have to, switch off all the screens, or you have to take away the screens at that time. Reach out and hug to them. That's like a very important emotional warmth and comfort it gives the parents. Yeah, coming to the screen time, because we are all about the screen. For the past 1.5 years, our children are always inside the house because of the lockdown, and they are attending schools through the online classrooms. So it's very important. I have to talk about the screen time. So what do you mean by screen time? So this is the amount of time spent using the devices, maybe the computer, mobile, the tablets, the iPad, whatever. So how much amount you are spending before the devices. So here you can see a child attending a class, online class. So whether the screen time is completely bad, because we cannot say no, especially at this present situation, we cannot say no, because the classrooms, because the classes are conducted through the online. Our children have to attend, and even from 3 years onwards, they are having some 3 hours class. So they have to attend. So it can carry, like, educational value that is there, and they can do even if they are attending the schools face to face, but the school related homework and research they can do through the internet. And it builds the knowledge, because children can improve the knowledge through that. It not only entertains, but it also teaches the children. It keeps the children occupied. Yes, that is there. And also it increases the social connections. Also, they can communicate. Now we are seeing mobile phones from our, from age 6 or 7, onwards. They are having their mobile phones. They are having friend friends, groups. We are having the social connections, and sometimes like it can be relaxing also to see some like programs. It reduces stress, and also we can read even the books on the screen. So these are some positive things. But okay, but the screen time we cannot actually you know uh, take it just like that, because we are having some recommendations from the American Academy of Pediatrics. Before like uh, uh, before they have told less than 2 years of age there should be no screen time, but now they have changed the recommendation also. But how you can actually do a healthy screen time? So for 18 months or younger, that is the less than 1.5 years, no screens are still the best. But the exception is the live video chat with the family and friends. So if the parent is staying far away, and if the child staying like especially in we are staying here, our children are staying there, means you can uh, call through the video chat. That is allowed. That is the only thing is allowed. Okay, it's more, not more than that. Less than 18 months. From 18 months to 2 years, you can limit the screen time, and also you have to limit the screen time to 1 hour, minimum 1 hour per day. And you have to avoid the solo use. You should not allow the child to use the screen by himself. You have to be with him. And whenever you are showing something, maybe some crimes or whatever, the stories or the Bible or whatever you are showing, you have to choose high quality educational programming. And also you watch with the kids to ensure the understanding. So this is very important. You should avoid the solo use less than 2 years. From 2 to 5 years, limit the screen time to 1 hour per day. This is the maximum limit. Apart from the educational thing, apart from the schooling, I'm not telling that. Other than that, limit to 1 hour per day. And parents should watch as well as to ensure understanding and application to their world. How, for their age related programs they can watch, but not more than 1 hour. And ages 6 and older, you have to place consistent time limits on the mobile devices or the devices they are using. And you have to always see what the types of media they are seeing. And don't allow the screen to be taken to their bedrooms. It will affect the sleep or the exercise. If they are having a playtime, it should not hinder that child in that doing that or other behaviors. So set a screen time for that. So we are having so many apps. Even I have set for my both kids. So we are having apps like a family link. So you can go for that and you can actually set the time, and you can just monitor how much they are watching and everything. Or YouTube, like if you want to like less than half an hour or so, you can set. And also you can allow or block certain apps. Even for YouTube Kids, like YouTube means you can block the YouTube and you give the YouTube Kids. So everything is possible. So you have to set limits for ages 6 and older. Up to 12 years, they have up to 13 years, I think they have set this thing. So you can use that. And also you have to set family like media free times, like meals or driving, or media free zones like bedrooms. So this is very important. And also like also to teach them how to behave online and offline. And also whenever the devices are allowed, you have to ask where the devices are allowed. Be sure that the devices are used in a common area of your home. The child should not take the devices and go to a separate room and watch by himself. That is very important, because he can watch anything. It should be in the common area of your home. And also you have to ask why you are using this, whether it is for entertainment or for education. You have to ask. So these are the questions you as parents we have to ask. And when it is allowed, have you finished all the homework? If he's watching some entertainment, have you finished his homework? Is this is the agreed time or no? So everything you have to ask. And also you can direct your child to activities like other activities like coloring, reading, playing outside, and helping with the chores. And too much screen time. So what is too much screen time? Whatever I have told you, if that's crossing the limit, that is called too much screen time. So it can affect. There are so many areas which are affected by the screen time. So the psychosocial risk, because of the increased screen time, there is lack of social interaction and engagement with the family and the friends. The children who are watching from very small age onwards, that's why we are telling less than 2 years, limit. So they can have language delays. Because I'm seeing so many patients coming to me like stating that child is not speaking even after 3 years old, because he's always involved with the screen. So there will be fewer vocalization, less babbling from the infants, because they are not expressing the significant expressive and receptive language delays in the preschool children. So it's a very important thing to be of great concern. And it can affect the physical health also, because increase in the childhood health disorders like obesities and diabetes. Because they are always sitting in one place and watching, they are not playing. And also in the life skills, the children, they are not experienced now. They are not able to tie their shoes. They're not able to swim. They're not able to ride a bicycle or they build blocks, because if they are too much exposed to the screen time. And what about the advertising? Like, if they are watching a game or something, or what they're watching, there are so many advertisements which they're coming. So there may be food related advertisements or something like, something which distracts them and go to a different path, or a different wrong path. So it will come. So always be concerned about that, and make sure that the apps will be paid. And it can also lead to poor sleep quality, because children, if they are, so I will come to that the next slide, how it is affecting the sleep and the vision. So I will deal with that. And also the behavioral concerns, like whatever I have told you, the behavioral problems. So if the screen time is more, the behavioral problems would also increase more. And if sleep is reduced, children will always exhibit the behavioral problems. And not only the sleep problems, the lower grades in school, they will read fewer books, and they will have less time with the family and friends and other ways of relaxation and fun. They'll not have enough time to outdoor or physical activity, the weight problems, the mood problems, and the violence and the risk-taking behaviors. Like, if they see some game or something, like they will want to do. Or if they are watching some violence, they will also do like that. So they will, or like, you learn so much bad things, like from if they're not properly, watching the right things. And they can have attention problems and the anxiety and depression, what I have told you. This will come if the screen time is high. And like, this is very important, because if the child is watching, especially in the night times, switching the lights off, and if he's watching, it's very bad, especially because the blue light which is emitted from the mobile phones and tablets, it can suppress the melatonin, which is the one thing which controls your sleep and wake schedule. So the more electronic devices you are used before you go to bed, it is harder for you to fall or stay asleep. And the light from the electronic devices keeps your brain alert. Even after you close the devices, your brain will be always alert, because the light, it has stimulated the brain. And sleeping with a phone in your room can wake you with noise or light from the incoming messages. So it's better. It's always the restriction to the bedroom. It should be carried out by the parents. And also eyes. How, like, if a child, like if he's not able to sleep, or if he's frequently rubbing his eyes, and his eyes are so tired with headaches and difficulty in focusing, then it's high time to look the ophthalmologist for his vision checkup, because the screen can actually cause even some damage to the retina. So if you know it early, it's better to take the treatment early, so that these kind of things can be avoided. And also, if you're seeing the screen, adjust the screen's brightness and the contrast, so that you can avoid the screen glare. And also use the screen in the arm's length level. So in an arm's length level, you have to use the screen, and below the eye level, and tilted away. Okay, so this is some certain things to be followed while the screen, and you have to play 1 or 2 hours daily every day. And discourage any use of screen which is held very close to the eyes. That's also very important. And if you're having these things, like if you're experiencing some kind of a vision thing, always look into the distance several times in an hour. So because our screen is always in front of us, our near vision is working, our distant vision is not working. So you have to look at a distance for several hours, so your eyes can contract and relax during the time. Keep the eyes moist, and also shut down your devices 2 hours before your sleep. And how the parents can reduce the screen time. Okay, you have to make sure that the child is watching the age appropriate views. It should not go beyond their age, and talk to a child of what they are seeing, and be aware of the advertising, whatever I have mentioned you before. And encourage a child to learn other activities, because if they do other activities like sports, music, and art, so their time will be spent there, and they will be off screens. and set a good example. That is very, very important. If we parents, if you're always like taking our mobile and if you're sitting in front of our children, then the children will also do like that. So set a good example. And also you have to teach your children about the online privacy and safety. That's very, very important, because safety, like, your information can be robbed, or like, it is always outside. Whatever your like, your account is always like, hackers can take. And so you have to teach that also. And parental control, that is very, very important. You can set the apps for the parental control. So as I told, it is addictive and interferes with the relationship. And for young children, be careful using the TV as a babysitter. That is very, very important, because all the maids and our, all our working parents, so our maids are at home, even at our house, like that's the thing which is happening. That's what, but we should not use that. You should not use their TV as a babysitter. Do not allow computers or TVs or cell phones in the children's rooms. And make agreements with the children about how much TV or the video games or the texting or the internet time is reasonable. And make time for other fun brainstorm activities. And tips for parents: agree on a clear set of rules and abide by the rules. This is very important. If you break the rule, child will also break the rule. So always follow the rules. Be a role model. Do as you say. Know when to unplug and curb your own bad digital habits. That's very important, because we are leading by example. And there should be phone-free zones in the, like, especially I told you, the bedroom and the dining room. It's better to be off the screens. And use an alarm clock in your child's bedroom, and do not charge your mobile phones, or do not allow them to take their mobile phones in their bedroom. And unplug every weekend, okay? Or whenever you go out, you have to tell to always switch it off, or like, you have to play. You should not go out and always look at that. And also, like, there are social media and how to explore, or you can discuss with the child if they are grown enough for that. And come to the parenting. So there are 4 parenting styles. So I know you all, like, we all will be fit to one or the other. Okay, there are 4 parenting style. One is the authoritative, the authoritarian, the permissive, and the uninvolved. So we had to ask ourselves, what is my parenting style? So if you're too much demanding, and if you're but at the same time, if you're demanding, but at the same time you're sensitive and responsive, it is authoritative. And if you're too much demanding, but you are very much disciplined, or you are very stern with your children, then it is authoritarian. But if you don't demand anything from your child, you are not at all placing any limits for your child, but at the same time you're sensitive and responsive, then it is a permissive parent type. You are not enforcing limits. At the same time, we are very, stern and punitive. You are in your own way. You are the uninvolved or the neglecting parents type. So authoritarian parents, the parents are controlling the children. They are having the strict discipline rules at home. And if the rules are broken, there will be a stern discipline and will be a punishment that follows. And they are having the high expectations, but with a little love and little warmth in front of the children. So children are like, you can see the first picture, like, the child is away, the father is like that, okay? But if we practice this kind of parenting, as time goes, the children will become insecure with us. They will have some behavioral disorders, behavioral problems, and they can exhibit poor academic and social skills. So don't be an authoritarian parent. Don't be an authority, because children, they are not like, we have to discipline, but it's not the way. You have to, at the same time, bring the warmth and the comfort they need with us. What is the authoritative parenting style? Here, the parents are responsive. They show both the strictness. They are disciplining the children, but at the same time, they were showing the warmth. Here also, the rules are there at home, and the expectations are clearly stated and justified. Why these rules are there? Why I have set the screen time limit, or why I have to, like, no screen in the bedroom. So these kind of rules. And appropriate and open communication. In the authoritarian type, there was no open communication between the child and the parent. Here, there is an open communication between the parents and the children. And here, the children will grow to be a happy, independent children and with good self-esteem. So whatever we have, like I have told you before, you need to apply. So how to bring them, like, in the way, good ways of mental health. So they will grow to be a good self-esteem children. And here the kids will develop the good social skills, how to behave with others, how to behave with themselves and others and elderly. So they will develop good social skills and they will achieve good academic success in this type. There, even if you're strict, if you're only like, authoritarian, because the child, they will not, because they will not spend their time in that, like, they will not strive to be. But here the children will achieve the academic success and they will grow to be responsible adults with a good mental health. So the parenting type which is preferred, or which is, as a Christian, we need to practice the authoritative parenting style, but not the other one, not the authoritarian. And other two parenting types also, I will tell you, the permissive parenting style. Here, the parents are caring. They are showing excessive warmth and excessive comfort and excessive responsiveness, but they are not strict with the rules. They are having a very friendly parent-child relationship. They are having an open communication. But here, the parents are not the decision makers. The children are the ones who are taking the decision. And instead of following rules, the children will take the decisions and they can break the rules also, because there is no rules at all. And the parents are low expectations. They are not expecting much from their children. They are like, oh, my child, like, I want him to be always happy. So this is their, permissive parenting style. Their thing is, I don't want to hurt my child. I don't want to, let him be. So this is the thing. So you should not be like that, because the children have poor self-control and they will be be unable to follow the rules, because as they will be comfortable at home. But once they go out, once they grow and meet other persons, these children will not be able to follow the rules there also. So as adults, that these children, when they are brought up with the permissive parents, they will develop an egocentric behavior and have the relationship problems, like, because they are getting everything they needed. They are satisfied. As soon as they tell, the parents will satisfy. So they will, so this is the permissive parents. So this should not be the case. As it is said in the Bible, we have to discipline and train our children in the right way. So whatever I have told, this authoritative parenting style is the thing which we have to practice. And uninvolved parenting style. Here, the parents are very neglectful. They neither show strictness nor warmth. Both are not there. Okay. So no discipline strategy, no communication between them, they will be on their own world, and the children will be on their own world. And they have no expectation from the children also, because they are not showing much much communication or warmth. They don't have expectations from the children. And here the children will be impulsive and they are having difficulty in regulating the emotions. I told about the emotional health before. So these children who are being brought up by the uninvolved parents or the neglecting parents, they will have very difficulty in controlling the emotions. And these children may develop the mental health and the behavioral problems, and they may require support or help from others to survive. Okay, coming to the last topic, I'll be finishing soon. The spiritual health. Yes, this is what the wellness. This is not like, the health that it has not, the definition of health doesn't carry the spiritual aspect, but the wellness carries this. So for a good spiritual health, we have to be a model before our children. You have to read your Bible every day, then our children will also see and they will read a Bible. And help the children to memorize the Bible verses. Yes, our church is doing that, like, they are memorizing and they are telling. So this is a very important thing. So these things will help the children to develop a good spiritual health. And pray every day. Pray, like the other people may tell the prayer or meditation or yoga, but for us, like speaking to our Heavenly Father, that will, remove all the anxieties, remove all the worries. So that is what a good Christian life. Model a good Christian life before your children, and they will also learn how you are dealing with your emotions, how you are dealing with your anxieties and worries. They will also learn, and they will also apply that in their life. And have a regular family prayer time. That is very, very important for a good family close, loving family. That's very, very important. If you don't have a regular family prayer, because this is the time where we can share our thoughts, our concerns, and one of you can just tell what he has learned from the Bible verse, yes, like today or like before, the day before. So you can have the sharing and the caring, and you can worship God together. So automatically, the Holy Spirit will start work in our children's hearts, even if they are not much mature to receive know the concepts or the understand whatever is written in the Bible. But everyday family prayer time will definitely help. And if you're a grown-up child, ask Jesus to come to your heart and accept him as your Lord and Savior. This is very, very important, because Lord Jesus alone can lead us in the path of righteousness. This is very important. He will give you the wisdom, he will give you the intellect, he will give you the favor of both God and man. So get the favor from God by accepting Jesus as your Savior, and receive the anointing of the Holy Spirit, the Spirit control life. So so only if you receive the anointing of the Holy Spirit, you can have a Spirit control life and grow every day in the fruit of the Spirit. Galatians was chapter 5 verses 22 to 23. All the fruit, like all the characters, it is a fruit, but it contains all the characters: that love, joy, peace, patience, kindness, goodness, faithfulness, gentleness, and self-control. So these things are very much important as the children are growing. So it cannot become in a day or two, like every day keeping in walking with Jesus and keeping in step with the Spirit. Like everyday transformation will happen in your heart and your minds, and so that one day you will be filled, like the fruit will come. And walking with Jesus every day, that's very important. And your character matters, because these things constitute our character, and we will become a good character children. So finally, children, so to recap, I just want to tell you, so it is a wellness, means it contains the physical, the intellectual aspect, the emotional aspect, the spiritual aspect, and the occupational. Occupational means our school and our play, everything. So all these together constitute the wellness. So once you be a wellness, you have to give back to your community. You can tell your children, like when you see, so like if you are showing a good positive mental attitude, your friends will ask you, why, what, you are always like this, how you are handling your emotions. They will come and ask you, and you can share with others, you can tell others, you can be, you can give back to your community. And finally, children, this is the slide I want to finish. Verse from Philippians 4 verse 8, chapter 4 verse 8. Finally, brothers, whatever is true, whatever is noble, whatever is right, whatever is pure, whatever is lovely, whatever is admirable, if anything is excellent or praiseworthy, think about such things. And I thank your children for your patient listening, and may God bless you all. Thank you.